It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Is your pet going to have surgery? You'll need these tips. No one wants their pet to have to go through surgery, but sometimes it's necessary to improve their quality of life. To give your pet the best chance of a quick and complete recovery, it's important to provide proper post-operative care. I'm offering you some tips to keep in mind when caring for your pet after surgery right now. 1. Follow instructions. The vet will send your pet home with a list of important instructions to follow exactly, such as isolating your pet if necessary, keeping him from jumping on furniture, and other important instructions. If you have any questions about post-operative instructions, talk to your vet so he can help you better understand them. It's best to do this before you leave the office with your pet, but if you get home and don't understand something, call the vet's office for clarification. 2. Learn about general anesthesia. In many cases, your pet will be given general anesthesia for the procedure. This renders your pet unconscious during the surgery, so it doesn't feel pain or move. It takes a while for the effect to wear off, and your pet may be sent home before the effects wear off completely. General anesthesia may cause your pet to be drowsy for a while or shaky when walking. He may also lose interest in eating when you get home. These are normal side effects that should go away with some rest and time. 3. Feed your pet. If your pet was given general anesthesia, he may feel nauseous or not be as hungry for a while. You may want to give him a small portion of a lighter food, such as rice and chicken, with your vet's approval, when you get home. This may be easier on his stomach than his regular food. Within 24 hours after surgery, your pet's appetite should return to normal. If you notice that your pet's appetite hasn't returned after 48 hours of surgery, call your vet. 4. Keep your pet comfortable. Your pet will need plenty of rest after surgery. If you have small children or other pets, you may need to isolate your pet in a separate room so they won't be disturbed or try to get up and run around. Set up a soft bed with plenty of room to stretch out. If you're worried your pet will try to get up and move around too much, consider putting them in a crate temporarily. You'll also need to keep your pet from climbing stairs or jumping on furniture, especially if they've had orthopedic surgery. This may require putting up baby gates or other barriers and keeping a close eye on your pet. 5. Care for the incision site. If your pet had stitches inside the wound, you probably won't need to do much to care for the incision site other than making sure it's clean, dry, and well bandaged. These stitches will dissolve on their own as your pet's incision heals. For pets that had stitches or staples placed on the outside of the incision, your veterinarian should remove them within 14 days of surgery. Your veterinarian will give you instructions on aftercare to follow based on the type of stitches. If your pet cannot stop trying to chew, bite, scratch, or otherwise bother the incision site or bandages, you may need to fit your pet with an Elizabethan collar. Most pets will quickly adjust to this collar, but you may need to monitor your pet closely or try another collar option while he or she adjusts to the obstacle. Keeping your pet's bandages dry is critical to keeping the incision site sterile. If your pet must go outside, make sure the bandages are covered with cling film or a bag to prevent moisture, grass, or dirt from coming into contact with the bandage or healing skin. Once back inside, remove the cover so your pet doesn't sweat around the incision. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.